And Newcastle Hospitals says its computer error has lost patient letters. What? Yeah, we're going to read into this more from the BBC, guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here with an article from the BBC with the headline, Newcastle Hospital says computer error lost patients' letters. This is not good for confidentiality and whatnot. This is quite bad. A hospital trust failed to send out 24,000 letters from senior doctors to patients after their GPs had become lost on a new computer system, the BBC had learned. Oh my god, 24,000! Newcastle Hospitals warned the problem dated back to 2018 is significant. Wait, this has been an issue since 2018. So it's 2023. We're talking from 5 years ago. That's very worrying. The BBC had been told that the problems occurred when letters requiring sign-off from senior doctors were placed into a folder few staff knew existed. Okay. The healthcare regulator has sought urgent assurances over patient safety. Most of the letters explain what should have happened when patients are discharged from hospital, but a significant number of the unsent letters are written by specialist clinics spelling out care that is needed for the patients. It means that some crucial tests and results may have been missed by patients. Potentially 20,000 or 24,000 of these are crucial. Staff have been told to recruit any results incidences of patient harm and ensure that they are addressed. Following routine inspection by the regulator, the Care Quality Commission, the CQC, in the summer, staff at the trust raised concerns about the delay in sending out correspondence. A subsequent review of all the trust consultants revealed that most had unsent letters in their electronic records. A source at the Newcastle Hospital told the BBC that consultants have raised issue about the electronic patient record system for years, complaining that it was slow and hard to use, but it had not been listened to. In a letter sent to the staff about the problem seen by the BBC, the Newcastle Trust explains that letters drafted by one member of staff had to be signed off by a second clinician who must change their user status to signing clinician before it can be sent. If that doesn't happen, letters end up in consultant's document folder and remained unsent until they are signed off correctly. Sounds like a lot of kerfuffle. But at the same time, it's like, if they have certain guidelines in that to make sure that it's sent off, like it's got to be done as well. Is it a question of the training? Like, is it a question of time? Is it a case of staffing? Like, what is it that has caused this issue? It's very worrying. The impact on patients. Yeah, this is the thing. The patients' care and well-being here is a concern here if they're not getting these crucial letters. Sarah Johnsfield, a CQC Interim Director of Operations in the North, said, "We took immediate action to request further details from the Trust to understand the extent of which people may be at risk, and evidence of the steps being taken to review the impact on patients, ensure people are safe and mitigate any risk to avoidable delays in treatments going forward." She said that the Trust had submitted an action plan and volunteered to provide weekly updates on its progress against the plans. The Trust said it will immediately deal with the 6,000 letter backlog from last year alone. More than 1,200 of these relate to medicines and emergency care. Some letters may be duplicates or created in error. In a separate letter seen by the BBC, Newcastle Hospital had told senior doctors that CQC was worried about the impact on patients. Dr. George Ryde, a GP and a chairman of the North East BMA Council, said there would be an incredible amount of information within those letters. If you didn't get the letter, you wouldn't have the results of scans and x-rays or blood tests. That's pretty significant to some people as well. They're really important to some people. He said GPs will be absolutely unaware of a change in medication or treatment if a patient has gone to hospital and receives a significant diagnosis. Sincerest apologies. Martin Wilson, Newcastle Hospital Chief Operating Officer, said he wanted to reassure patients that we're taking immediate steps to address the issue. We sincerely apologise for any anxiety or inconvenience this may cause, he added. The hospital trust said it was working to understand if there had been any impact to ongoing care and treatment of patients. It is currently reviewing 24,000 documents from its electronic records, which account for less than 0.3% of all contact with patients, the trust said. If any concerns are identified, we will inform patients of their GPs directly, Mr. Wilson said. We are taking this issue very seriously and working quickly to put things right. The CQ said it was monitoring the trust closely and would inspect at any time if it had concerns. We will report the full findings from our latest inspection on any areas where the trust has been required to make the improvements as soon as we're able to, it said. If anyone has any concerns about the care they have received, they can let us know directly. People were concerned about being asked to visit the CQC's feedback on the care website. Issues over lost hospital letters may be more widespread. I hope not. I hope it's only just one. Well, it says Newcastle Hospitals, so I hope it's not a widespread issue. This is really worrying, guys. Like, patient safety here is at a great risk. Like, my question is how did this happen? Like, is this down? Like, for me, is it a case of was the training? What is it? A case of training? Is it the system too complicated? Does it need to be simplified? Like, a lot of questions need to be asked here because patient safety is at huge risk. There are people who haven't gotten these letters that could make a massive difference to their lives. It could even be significantly a case of life and death for some of these if they don't get these letters. That's how significant this is. And it's a very worrying thing. I just hope they clear this and sort this out as quickly as possible. And I think they need to take a look and have a look at other hospitals and make sure that they are, if they have similar systems in place, to make sure that they are being adequately in order as well. And you don't have an error like this. Errors like these are hugely significant. You cannot afford this, especially when it comes to the care of people's lives, people's medical conditions. All these things, they need to be taken into account. It's extremely concerning. Well, what do you guys think? Let me know down in the comments section below about this error in lost patient letters. What is it like in comparison maybe to some of you guys over in other nations? Do you think any hospitals have had these issues before? And if so, how have they dealt with them as far as you're aware? Like, share and subscribe as always. Thank you very much for watching, and I hope to catch you all very, very soon.